So welcome back to the channel, everybody. We have another exciting topic today. My name is Dhalia Masud. I'm a plastic and reconstructive surgeon.
I'm Rachel, practice manager.
I'm Hayley.
So today we are going to be talking about plastic surgery, but also the misconceptions of what people expect after plastic surgery and how the maintenance is required, which sometimes people seem to forget. So let's crack on. Okay. We get a lot of patients, we get face, we get breast, we get body. One of the things I find, and I think this is quite common, not only in patients but in the general population, is that when people want to have surgery to make themselves look better, whether it's the breast, whether it's the body, I think that's the final result at the end of it. And they don't really think about what's going to happen to their body in 5 years' time or 3 years' time. One of the key factors of having a good result long term is maintaining weight and a healthy diet.
Yeah.
Okay. If you, for example, have had children and you've got an overhanging area and you've got scar tissue in that area, what would be your expectations in what would you want to achieve after surgery, both in the short term and the long term? What would be your goals?
My unrealistic goal would be flat stomach, look like I did when I was 18. I think that's probably what some of our clients are expecting. But the realisation is you'll get the flatter, but you will have scarring. And if you start putting on weight, you're then going to have issues again where you probably need to have the surgery again.
Yeah, and I think scarring is a big, massive trade-off of all forms of surgery.
Yeah.
So that's a really key factor. So if you think surgery can be done without scarring,
Yeah.
it's not a good thing.
No. And the scars are big, aren't they,
Yeah.
when you do abdominal surgery?
Yeah.
They are long.
I guess if someone's had cesarean, that scar exists already for them, doesn't it? So actually, the tummy tuck scarring is not going to, it's already there anyway.
With scar,
Tummy tuck is higher though, isn't it?
it's usually at the same level. So a tummy tuck will be at the same level,
Okay.
or maybe it depends on who does the C-section.
Okay.
Some people have quite high C-section scars, some people have quite low C-section scars, but it's generally around the same.
So they're Nicolines, isn't it?
So for them, the trade-off probably doesn't feel as dramatic, does it? If someone's had a normal delivery and then the thought of that scar, that's a much bigger consideration.
But the C-section scar, obviously when you have surgery, that's going to be longer, isn't it?
Yeah, that's really the point. So your C-section scar is shorter.
Okay.
Yeah.
And your abdominoplasty scar will generally go longer. We say hip to hip.
Yeah.
And it will, if it's around the level of the C-section scar, we might try and get rid of the C-section scar if that's the goal. But some people have quite low C-section scars.
Okay.
So it depends on the level of laxity,
Yeah.
whether you're able to catch that C-section scar or whether we leave part of it behind.
So you wouldn't just be able to nip tuck that C-section scar, you've literally got to go the whole way.
You have to go the whole way.
Oh, really?
Yeah. So that the length of the scarring
Yeah.
won't put you off.
Yeah.
Yeah.
Personally,
Yeah, no,
it
it's
would,
good.
because it is quite, obviously I've seen the ones that you do, they are long.
But remember, when they do fade to
They do
white,
fade.
don't they? Of course, when you first see them, it's all very red.
I think it's that, like you say, trade-off. My stomach's not going to look as good as somebody who's had that done. I don't know, maybe later on.
Yeah, scarring is a major trade-off of surgery, but the benefits are a flatter tummy, narrower waist, being able to wear your clothes, getting rid of potential. Some people have the overhang and they've got infection underneath there. So the trade-off is the scar.
Yeah.
But you're absolutely right to be concerned about the scar. And the reason why I emphasise on talking about the trade-offs is about 60% of people who have cosmetic surgery who later down the line regret
Really?
having the
60%?
Yeah.
Because of the scars.
Lots of reasons.
lots of
it hasn't met their, generally it's because it hasn't met their expectations.
Yeah.
It's very costly.
Yeah.
You've got a lot of downtime. They're young, fit and healthy generally. And we are making you sick. So the trade-offs for them, because they haven't become aware of it, is a big deal.
I think that is what puts me off at the moment, because I'm fit and healthy. I don't really want to go be put back again. Only gives me PTSD of having the C-sections and how off I was.
There's a risk with all surgery as well, isn't there? Always. So you're putting yourself potentially under other risks and complications.
Yeah, so it's really important.
However, the ones that I've seen, they do look really good. They do look good.
They look good, but even if they look good, if it still hasn't met their expectations, if they didn't expect the scarring, if they didn't expect the numbness, that satisfaction rate goes down.
Yeah.
So it's really important for every patient to be aware of the trade-offs and risks, and I try and emphasise that through videos, through the talks.
Yeah.
Risks are real, and that's the thing about surgery. People are very good at showing their immediate results, immediate tummy tuck results, immediate boob results, immediate face results, but actually the final results come after a year, 2 years. And that's when you should be judging it, but we don't see many 1 2 year.
I was going to say, I haven't seen any post-op pictures.
After 1 to 2, we show 1 to 2 years. The immediate results are always going to be good because the swelling kind of adds to it. But 1 to 2 years down the line, it doesn't look good because the swelling goes down. And also people's body changes, which hasn't been compensated for or discussed, or they'll.
It's almost like you need to be at the exact weight that you can maintain forever before you have it. Because if you then lose weight, I'm assuming that will have
any changes. Yeah.
And the same as if you gain weight, you are really investing quite a lot of money to make that choice, aren't you? It's a bit like boobs. I always think with boobs, when you have implants put in, again, it's not a one and done thing. You then have to make sure that you can finance that again in another 10 years, or if something was to happen 5 years down the line where you actually feel like, because you can get ill, can't you? There is that thing where you can get ill with that you have the finances to then remove them, if not you're a bit stuck.
Yeah.
Because can you get this stuff done on the NHS?
Not really. We try and treat people functionally. So if you have a recurrence in your overhanging skin and you get infections, we'll treat the infection and we'll treat the scar, but we won't correct the contour of the entire body.
No.
And so you will be a little bit stuck. Even with implants, if you've had them put in cosmetically at the moment, we can take them out. If you've got capsular contracture, we can put new ones back in.
But you're not going to then make them look better, are you? Just
the goal is to treat you symptomatically.
Yeah. Which is fair in some respects, because the NHS is there to make you better, but it's not going to make you look like...
Not to change you.
Just
to make you...
And in terms of when you've had your surgery, you've got a lot of swelling.
Yeah.
Then you have to wait for the swelling to go down, and you need to maintain your weight. And there are a lot of things that we can do to help with the swelling, to help with the tightening, which people seem to forget as well, other than the diet, maintaining a healthy exercise. There's lots of non-surgical things which you do a little bit.
Yeah, so radio frequency is a really good one to do it as an add-on after your surgery, so it just helps maintain and probably get the results you want quicker.
Have you had, what are the negative sides, do you think, of the radio frequency?
I don't actually think there are any negative side effects to it. No. The thing is, you need to make sure that you start off at the right level and work your way up.
I think the negative thing will probably be, for some people, it's not as effective.
Yeah, I mean,
that varies from person to person, doesn't it?
Yeah, it's not a miracle. It's going to be able to fix everything as quick as surgery will, but it will tighten everything, which is what you want. And it's a really nice treatment.
Yeah.
Is it more effective on certain body areas than others? Is the face better? Or?
I think, in my personal experience, I found it's really effective on the face and the tummy region.
Yeah.
They're the two areas that I found it being really effective in. But like I said, everyone is different. And everyone is different.
And you can use it on your whole body to a point, can't you? Like arms, legs.
Yeah.
It's good.
And in terms of post-operative surgical, postoperative maintenance, is there anything that you didn't realise that you had to do after surgery before coming here?
I wouldn't have known that you had to sleep upright for a lot of things.
That's a good one.
Yeah, so that was a surprise. That is on most surgery, or even if your body's, if you're not sleeping upright, depending where the surgery is, you'd be elevating something, wouldn't you?
No drive.
So actually, sleep is really affected initially. Yeah, I think I wouldn't have realised how long it takes to recover, especially with rhinoplasty. I've never realised that the full result isn't revealed perhaps for up to a year or around the year. So yeah, that was a surprise. I think most people wouldn't realise that until they explain.
Yeah,
do you
I didn't know
think?
that.
No.
I'd have thought 6 months maximum.
Yeah. Just take a while.
Or I'd have just thought you had the rhinoplasty and ta-da, this is it. It's done, my new nose. So yeah, I was surprised about that.
Also with breasts, people think that you'll have the breast and you'll have the results and they stay upright and they'll stay upright forever.
Yeah.
They don't. If you, it just, gravity takes over and it drops. And the bigger you go, the less support you have for the implant.
And that's when you get the rippling in the
That's when
skin
you
as
get the
well.
rippling.
And I think people often think with a breast lift, with mastopexy, they're going to get that fullness in the upper pole, and that doesn't happen, does it?
If you just have a pure breast reduction or only breast lift, it's not going to
it's
give
more
you
the
that.
lower pole being raised, isn't it? So
That's something that's good expectations that we just need to let patients know. And without those factors not being understood, that's why you get dissatisfaction rate.
Yeah, I think maybe as well, I know it's something we talked about before, but it brings back how important the honesty is of what they've had done, what medication they're on. It's like everything that's already going on that makes up that picture of that patient. It's so important in terms of how the end result is going to look as well, isn't it?
Yeah.
If there's things that have been missed off or that haven't been transparent for you, then that's all going to have an effect.
Because Manjaro is a massive thing, isn't it? Like, people need to tell surgeons if they're on it, because it does something to them.
There's lots of studies out there still coming out, but it definitely affects the quality of fat.
That's it, yeah.
It definitely affects, for some people, healing, because you're not eating your normal amount of nutrition, number one. Number two, you've lost a lot of fat in a very short period of time. And when you operate in patients in that category, the fat is very different. It's softer, it doesn't have the structure, probably because they haven't had the nutrition that they would have normally had if they ate. And so they are, I found they're more prone to wound breakdowns. And even within our cohort of patients discussing, our doctors discussing issues, we've had internally a lot of problems with Manjaro and healing just because they break down, and they break down horribly because of the nutrition and quick loss of fat.
So in regards to that, if you are on it, how, because I'm assuming it can be reversed once you come off the Manjaro.
So it's not about reversing, it's more about making sure that you're nutritionally.
Okay.
So even if you are on Manjaro, we can operate on you as long as you are having your nutrition.
Okay.
So by that, would you mean the portion of the amount of protein to carbs to fat, that ratio?
Exactly.
So if you've been careful in monitoring all of that, and not just because presumably you're not feeling hungry, it's not don't eat all day, you still eat.
You still eat.
Yeah.
Particularly before surgery, you have to get your protein in, and definitely after surgery. And the problem with Manjaro is a lot of people just don't eat, and when they do eat, they eat rubbish food that doesn't have any nutritional value because it's just easy and it's there, and because they're not eating regularly, they're not cooking regularly, and that desire to cook large amounts of food is no longer there. So that is a major factor when it comes to the weight loss drugs.
Okay.
So
I think that's definitely going to be unexpected with people then, don't you?
I think
Because
so
it's
many
such a
people are
new
now
thing.
on it because there's so many.
Yeah, and it affects your gut motility, so you need to let your anaesthetist know.
Oh yeah.
Because you do have issues. Everything is really slowed down, so you still have food in your tummy.
Yeah. So do they have to starve for longer then?
The anaesthetists do their own thing to change it.
Yeah.
But yeah, it does affect their gut motility.
So if you're on it and you're having surgery, make people aware.
Yeah.
So
what do you come across with patients as the most unexpected part of surgery then?
in
terms of the recovery and what follows? I know you said about there being regret of people that have had surgery for whatever reason. So is there like a common theme that comes up?
I think the common theme is people seem to forget that their body changes over a 2 to 3 year period.
Yeah.
And they haven't compensated or added that into their idea of what their body will look like. So I've done facelifts on people, and then they've gone on the weight loss stuff, and then they've lost the weight. And you think, you've got the laxity, but the two for them didn't add up.
So they just see a not satisfactory result rather than their part.
Yeah.
Okay, yeah.
So it's really important to, and I don't know why people seem to forget it's really important to maintain a healthy diet or maintain weight. It is emphasised, but I don't know if it's people forget or they just think.
I think they just think, it won't affect me, and I'll still look fine because I've had surgery.
I think that's a common human thing, isn't
Yeah.
it? With everything, I won't be that one.
Yeah, you're not going to
that happens to. Yeah.
And it's the same with tummy tucks. It does change. It changes significantly. So maintaining weight is really important. And the long term, particularly with breast implants, the number of times I've seen patients with breast implants and they come and they said, I hadn't realised that I needed to have a checkup in 10 to 15 years time.
Yeah.
I hadn't realised that my implants might go hard because of the capsule. And just things like that, whether
So
it was
that's
overlooked.
Whoever that was not maybe explaining that all fully then. So
I think that sometimes if you really want them, you don't listen to the other. If you want them that badly, I don't want it. That's tomorrow's problem. That's not today's problem.
That's really interesting.
Yeah.
What do you think we could do to emphasise it's not tomorrow's problem?
I think like with things that you see nowadays, everybody seems like they have an endless supply of money, don't they? Like when you look online, that one's got a new car, and it's just a constant thing. I think what people forget is that some of this might be ticked up a little bit, maybe it's unaffordable, and I think it's really important that actually, if I was to have my boobs done now, I would try and save half the money to the side, so that over the next 10 years, half my boobs might already be paid for, because you're going to have them redone.
Or at least checked up, or have a scan, pay for a scan and things like that.
Yeah, because actually, as we know, you'll have some patients that will go to the NHS and want to have them sorted out there, but that really isn't, that's really not an NHS problem. That's, you decided to have that, you've paid for that privately, you can't add that burden on, and actually you might end up having them just removed, but it's not going to give you... The surgeons there are there to remove a problem, not then it's not a cosmetic thing, is it?
But
in terms of
the expectations of surgery.
What I come up again, I think it is the recovery period, I think people think they're going to just, after a couple of days, be bouncing out of bed and kind of back to normal activity. I think people find it really hard, the whole do not lift, do not bend, and this can actually go on for several weeks. So commonly people will have overdone it.
Yeah.
And it's really hard. You're not there to see how people's lifestyles are. They might have someone who's taken time off work for 1 week to help them, but actually 1 week isn't enough because they are not back to their normal activity after a week.
No.
So I think this is quite a common thing. And then comes along swelling and adverse reactions to this overactivity.
So people underestimate the recovery.
Yeah, I think they do.
Massively.
I think as well, because if you feel good in yourself, you're just like, I'll be fine. Actually, you're not fine. You just feel good. Either the drugs are working or you're resting, which is what you
your
should
body
be doing.
has so much to go through to repair itself, doesn't it? So, getting enough rest.
So it's really important to allocate time post-surgery really emphasise on the trade-offs of surgery and realise that your body will change and you need to try and factor that in when you have plastic surgery of any sort, whether it be breast, face, tummy, and hopefully your satisfaction rate will be higher.
Yeah. Just realistic expectations.
Yeah, realistic expectation. Great. And we will thank you very much for joining us, and hopefully we'll see you in the next one.